Whipta, if I had surgery without telling my mom? From user lean_cannoli. Some background info. I, 32F, have endometriosis. Among the most effective treatments is excision surgery and sometimes a hysterectomy. A year ago, my dad passed from cancer. He fought a very brutal battle for a year before that. My mom was his main caretaker, as he only entered hospice a few days before he passed. I was not heavily involved in his care for most of that time because I live a few hours away and my dad really didn't want me there for his bad moments. I think he wanted to spare me as much pain as he could and only wanted to see me when he was able to put on a brave face for me. My mom has a lot of trauma related to that caretaker role and being the primary witness to my dad's suffering. Now, on to the main question. I have had 3 surgeries for my endos so far, including having 1 ovary removed. My symptoms were tolerable until last year, when I started having 13-day periods and pain so bad that some days I could barely walk. I've started seeing a specialist, and at some point I will probably have another excision surgery and a hysterectomy. If there were no other factors, I would do it now, but my mom still struggles with anything medical/caretaker related. Right now, she's in a bad place because my aunt, her sister, just had surgery for her cancer. I can also see the toll it's taking on her, so my current management for my endo has been based on just managing my symptoms to buy my mom more time to recover before I have surgery. To help suppress my symptoms, my doctor has me on a much more intense birth control dose to try to stop my period. The full dose gave me really bad side effects, so I tried a half dose, but after a few months that stopped working. I'm attempting to tolerate the side effects of the full dose. The doctor has told me to give it 3 months to see if they go away. I am currently having regular headaches, constant exhaustion, and mild depression, plus some remaining endo pain. If these side effects don't go away, I may need to go the surgery route before my mom is ready. If it comes to that, I've been thinking about just having the surgery in secret. I know my mom, she would force herself to be there and take care of me. I have a friend who could stay with me while I recovered. She works from home, and my SAL is an NP who could be the one at the hospital who I could give permission to make any medical decisions if something came up during surgery. This should be a low-risk laparoscopic surgery, so I think I could get away with this. But also, I can't imagine how my mom would feel if something went wrong, or even if it all went fine, but she found out later that I'd hidden it. DR, I may need a relatively low-risk outpatient surgery in the near future. My mom has severe trauma surrounding hospitals and being a caretaker for my dad while he was dying last year. Whipta, if I had the surgery without telling her so she wouldn't force herself to try and be there for me?